For someone fighting cancer, time becomes a precious commodity. So providing the right treatment at the right time can mean the difference between life and death. Our next guest is Dr. Robert Nagourney, the founder of Rational Therapeutics, a company he established in 1993 when he pioneered personalized cancer therapy using functional profiling. This approach recognizes that just as each person's cancer is unique, their treatment should be too. Dr. Nagourney is also the author of Outliving Cancer. He's board certified in internal medicine, medical oncology, and hematology. He's also an instructor of pharmacology at the University of California's Irvine School of Medicine. Dr. Nagourney joins me now to discuss his specialized approach and how cancer patients can play a more active role in their treatment decisions so that they too can outlive cancer. Welcome. So good to have you here.
Thank you for having me, Mike.
You know what I find fascinating is the title, Cancer Doesn't Grow Too Much, It Dies Too Little. Is the problem, I mean, we've been fighting cancer, I shouldn't say we, you, everybody else, been fighting cancer for decades. Have we been looking at it the wrong way?
That's actually a great question, Mike. And actually, the answer is yes, we have. There are two fundamental changes that we brought to the table in our work. The first was recognizing, since 1972, when the first paper on this topic was published, that cancer is not a disease of cells that grow too much. It's not a disease of proliferation and DNA synthesis and cell division. It's really cells that live longer than their counterparts and are present in the body to have extra generations. They outperform not by growth, but by just living longer. And so we, first of all, have to address cancer where it lives, which is in its longevity.
Well, here's something interesting. I love your book. It's very thought-provoking. I want to read a section because the one thing I came away with, and you may say, no, Mike, you're way off the mark, but I'm back in Washington, D.C. I think Washington, D.C. is really messed up. But when I was reading this, I was like, some of what's going on with cancer is pretty messed up. And I'll read this section. You don't go to the airport to find out where the airline isn't flying. You don't go to the restaurant to find out what they aren't serving. And cancer patients don't go to their doctors to find out what not to take. It's almost, you talk about what should be focused on, and a lot of times it seems as though they're focusing on the wrong things.
Well, that really comes from the error fundamental to the way we looked at cancer. We used to think that cancer grew too much, and so we studied its growth. And to find drugs and combinations to treat it, we would then see what drugs stopped it from growing. Well, as a result, we really didn't get any answers. I mean, people didn't get better when we selected it. And so one laboratory said, well, if a cancer cell exposed to drugs can grow happily, then it's probably very resistant. And under the circumstances, a new field was born, which was the drug resistance field. And what they told you was, well, we may not be able to tell you what will work, but we'll tell you what doesn't work. And for a long period of time, people were selling that as a service. We'll tell you what not to take. And that was where that quote came from, because I didn't think that was useful. I think what people really want to do when they get cancer, they don't really care what they shouldn't take. There are plenty of bad drugs. What they want to know is what drug will make me better, and that really is what I've focused on.
Take me inside your noggin, because so many people are thinking in a certain way. You start thinking outside the box, which, you know, has led you, I would think, in a different path than many people who are just kind of going the traditional route. Why did you start thinking the way that you think, and walk us through this process?
Well, as you mentioned in the book, I described some of this. I left my residency in medicine thinking that I was a pretty qualified physician, that I could treat people for most diseases. And I took my training in cancer medicine, and most of my patients didn't do very well. And I was very disappointed. I began to feel that maybe I'd lost my skill set. Maybe I was no longer as good at this as I really should be. So I began to wonder, well, can I do a better job at this? And I met a colleague who had trained at the National Cancer Institute, and he was studying cancer cells in the tissue culture environment. So I said, well, could we use that? Could we use patients' tissues to guide our therapy? And that got me into thinking, well, if they say you can't do that, what else have they said that they say you can't do that really probably works? And that's kind of launched me into always questioning conventional wisdom.
I've got two children. My daughter, when she was born, I used to rock her like this and she'd fall asleep. I tried it with my son. It didn't work. I mean, each person's different. Each cancer's different. And yet it doesn't seem like that it's approached that way. Would you agree? It just seems like it's kind of like, well, we'll just lump everybody together and we'll see what happens.
Well, obviously everybody wants to do a better job at this. We've clearly been working in a field, in a universe where people are trying. The problem today is that we're in love with the gene. And we're so convinced that all the answers are found in the informatics that we study gene profiles. And there's an article in today's New York Times where they talk about the fact that some of this big science isn't necessarily working because the gene information is a veneer of information that doesn't make you you. Everyone carries basically the same genes, but one person gets cancer, one person's a basketball player. Everyone uses their genetic information differently, just like your son and daughter are different people. Everybody's cancer is unique. And if we try to use their informatics, their genetic profile, their blueprint, very often we don't get answers that specifically describe them. I use the sort of simple analogy that my father had blue eyes. Now, as a result of that, my father gave me, somewhere along the line, a blue eye gene. I must have one. If you do my genomic analysis, you're going to find a blue eye gene, but I promise you, I don't have blue eyes. So if you find the information and you don't turn it into the person, then you're only getting the possibilities, not the actual person. And that's what we do. We do something called phenotype, which is you. Genotype's your blueprint. Phenotype is the building. You're a building. You're not a blueprint. So,
and what are you finding with that? I mean, what's your success rate? What type of cancers are you going after?
we can test almost any kind of cancer. We have patients with leukemia, ovarian, lung, prostate. Any cancer that is going to go through surgery or biopsy can arguably have a tissue submitted to our laboratory to test.
Stage 4 cancer patients have come to you and actually seen success. It seems to me, and I know someone very dear to me who recently passed away, and it almost seemed the minute he started talking to doctors, it's curtains. And talk to me about that approach, and also why do you think you're seeing some success when it comes to these really troubling, difficult cases?
Well, to some degree, physicians do not want to give patients a false expectation. So if the physician says to the patient, your odds are not very good, you ought to prepare for the end, the patients will factor into their plans the possibility they won't live very long. The problem, as I see it, is that the patient is then depressed. And some of their defenses against this difficult disease is their own emotional and spiritual belief that they can survive. I don't think it's always in the patient's best interest to be bludgeoned with bad expectations. I try to be upbeat, and every patient is their own story in real time. I mean, when you treat a patient, everyone has the chance to get better. Whether we win every time is uncertain, but you shouldn't start off defeated. So we try to incorporate into the patient's thinking that they can survive. And we have patients, I have one charming patient with lung cancer who came to me with a seizure because she had brain involvement from lung cancer. And when I met her, she was so convinced she was going to die that when I explained that we were sure we could help her, she started crying and said, "You mean I'm not going to die?" That was 6.5 years ago.
Can cancer be cured?
It's a very difficult question. I think some cancers can be cured, but we're not curing cancers today much better than we were curing those same cancers 20 or 30 years ago. Today, we can cure some leukemias, some lymphomas, some testiculars, many testiculars, but we're still not curing most lung cancers, most melanomas, most gastric cancers, most colon cancers. We're very, very slowly pushing out the long-term survivorship. So yes, we're getting more responses. Sometimes the treatments are smarter, but in terms of the overall survival, it's very small impacts.
Someone gave me this statistic, and I'm sure you'll probably know if it's true or not. Every 2 days is a 9/11 when it comes to cancer patients. There's so many are dying, and yet our country seems stuck. Disruptive, it seems to me, we've been going traditional for a long time. Disruptive seems the right avenue. Why the disconnect?
Well, again, the term disruptive is exactly that. You tend to break the mold. You know, there's the joke that you can tell the pioneers are the ones with all the arrows in their backs. So you're confronting people who are unwilling to change. Now, I don't blame doctors. It isn't that physicians don't want to help their patients. It's just that they're risk averse, that they're hesitant to step off the block to see if they actually can swim, to see if you really can do this. So you find yourself needing to re-educate people on how they do things, and they're comfortable in the way they're doing it. They're told by the powers that be that they're doing the right thing, and so you come along and want to change all that, and people are a little resistant.
Do you see cancer as an adversary where you're just looking for that Achilles heel? If we can just hit it, we're on our way?
I think that cancer is an accident in our process of evolution. I think we as a species are evolving. And I think we have mistakes. And cancer is a reconfiguring of what makes us us. And every so often, a given person spins off in the wrong direction and crashes. But in fact, the mutability of our genome is hopefully, I hope, is moving forward. And so cancer may be a side effect of all of our mutational events and different changes that are ultimately, hopefully, taking us somewhere.
I think everybody has been touched by cancer in some way. And I think some people watching this might say, what should I be doing to prevent cancer? Are there steps that we can take?
Yes. Cancer is, as I said, perhaps an accident, but it's also a response to perhaps our environmental, and I don't mean environment in terms of pollution, but I mean in terms of our micro environment, in terms of how we treat our bodies. I think to some degree chronic diseases are a reflection of our lifestyles and diets. Mankind discovered agrarian existence 10,000 years ago and he went from being relatively mobile and eating sparsely to having lots of calorie-rich foods and sitting around all the time. So we developed osteoporosis and cardiovascular disease and tooth decay and cancer. And in a way, it may be that our lifestyle is partly to blame. Now, obviously, you can eliminate cigarette smoking and you can do things that are smart. But sleep and wake patterns, for example, we live under lights, but our body was designed to have the day-night sleep-wake appropriate. And there are entire genetic codes in our system that define that, but they define other functions within the body. Our dietary intake, when we have large influxes of calorie-rich, fiber-poor food so that our body gets a lot of calories but doesn't have to work for them, well, that provides all cells, including the bad ones, a ready source of energy. So lifestyle, exercise. Exercise isn't just good for you. It is biochemically protecting you against illness. So yeah, I mean, the funny things that your mother would tell you, what to eat and how to live your life, she was right.
Mom was right about a lot of things. Thanks so much for stopping by.
Absolutely.
It was a pleasure.
Thank you for having me.
Coming up next, this week's full-frame close-up on a man who leads two very different lives, a physician by day and an innovative artist by night.